Hi everyone. So today's video is regarding the side effects from pantoprazole, which is an antacid. So today in this video we are going to talk about the side effects and we are also going to talk about why they occur. Now let's first talk about what pantoprazole is. So pantoprazole is a medication used to treat gastroesophageal reflux disease or GERD. So that is, it is used to treat symptoms of acid reflux. It is a proton pump inhibitor or PPI, which is a medication that reduces the action of proton pumps. So proton pumps are these little pumps that occur on certain cell in the stomach called parietal cells, and these cells actually pump out the plus ions, H plus ions. So these H plus ions acidifies the stomach, and PPIs like phenoprazole actually inhibit those proton pumps. So the stomach doesn't become as acidified as it should. And this is why it treats symptoms of gastroesophageal reflux disease. And along with pantoprazole, there are other PPIs including omeprazole as well. And again, these PPIs act to inhibit H plus ions or hydrogen ion pumping into the stomach to acidify the stomach, so they lead to a reduction in stomach acidity, which would actually mean that pH of the stomach rises. But the problem with pantoprazole use, including other PPI omeprazole, is that they can cause a variety of mild side effects and other potential medical issues like nutrient deficiencies. And in fact, actions we are going to talk about those we are going to see in this video. So let us know what are the side effects caused by pantoprazole or omeprazole. The first side effect is headache. So headaches are actually one of the most common side effects of pantoprazole use, and they are generally mild in severity, and they can occur in up to 4% of patients. Next is abdominal pain is also another common side effect, and it occurs in approximately 4% of patients. As well as this abdominal pain can co-occur with other gastrointestinal manifestations, which we are going to talk. Some of those gastrointestinal manifestations include bowel habit changes. So, bowel habit changes can include watery diarrhea. So, watery diarrhea in some patients because of the use of pantoprazole and other PPIs, and it occurs in roughly 4% of patients. And some patients may experience constipation, and patients can also see the issues with increased flatulence as well with pantoprazole use. Other side effects are nausea and vomiting with proton pump inhibitor usage. So, nausea can occur in approximately 1% of patients. Vomiting or regurgitation is more likely to occur. And we can also see in few patients, chest pain is the common problem. And few patients may be suffering from dizziness. Generally, mild dizziness in some patients may be noted who use PPIs like pantoprazole. Pruritus can also be another side effect. Pruritus is going to be an itching sensation. It can be generalized in multiple areas of the body, may feel itchy, and up to 4% of patients who use pantoprazole can have itching or pruritus. Skin rashes is also some of the side effects. Skin redness and inflammation can occur. Hives can occur in some patients. So these bumps or swellings can occur, and this can also be generalized as well. And approximately about 4% of the patients who use proton pump inhibitors can be affected with skin rash. Facial swelling is also another side effect of pantoprazole use. So now some other important nutrient issues that we can see with the pantoprazole use is hypomagnesemia. Or so hypomagnesemia is going to be low magnesium level in the blood. And generally speaking, this is thought to be a rarer occurrence, but a lot of times patient may be seen in hospital. They are on a proton pump inhibitor for a long period of time, and they have lower magnesium levels than they should. And sometimes proton pump inhibitor can actually be the cause of low magnesium level. And another important finding in proton pump inhibitor usage patients is a vitamin B12 or cobalamin deficiency. This is going to be more likely occur in patients who are taking proton pump inhibitors for a long time, especially greater than 3 years. And it can cause signs and symptoms of vitamin B12 deficiency if so severe. And the reason that this can occur is because of the proton pump inhibitor usage, which in turn leads to reducing the acidity in the stomach. The stomach is not able to digest certain nutrients as well as it should do. So you need to maintain a certain level, very low pH level, in order to access some of the nutrients in the food that we eat. So, some other side effects or long term medical issues that can occur with pantoprazole use is osteoporosis and bone fractures. So, there can be increased risk of osteoporosis and bone fractures with long term use of pantoprazole drugs. So, there's a higher likelihood of fractures to the hip, wrist, and spine. And again, this is often going to be many years on pantoprazole or other PPI usage. So that's all for today. I hope you found my video informative, and if so, please do not forget to like and share this video with your relatives and friends. And please don't forget to subscribe to my channel for more lessons like this. Thank you so much for watching my video. See you in the next video.